Today, we are going to talk about maxillary topical anesthetic. We are using cheek retractors for demonstration purposes only. The first nerve we are going to talk about is the ASA, the anterior superior alveolar nerve. The landmark is between the 1 and the 2, or the 2 and the 3, operator preference. It will affect teeth number 1, 2, and 3. A short needle is used. It also affects the lip, vestibular mucosa, and nose. When applying topical, you are going to dry, retract, and place. So I'm applying between the 1 and 2, or 2 and 3. The next nerve we're going to talk about is the MSA, the middle superior alveolar nerve. The landmark is between the 4 and the 5. A short needle is used. It affects the 4, 5, and mesial buccal root of the 6. It also affects the lip and buccal mucosa. Once again, you would dry, retract, and place the topical into the buccal fold between the 4 and the 5. The next nerve we're going to talk about is the PSA, the posterior superior alveolar nerve. The landmark is between the 7 and the 8. It affects the distal buccal and palatal roots of the 6 and all roots of the 7 and 8. A long needle is used. It also affects buccal mucosa. So once again, you would dry the area and you would retract and apply. The next nerve we're going to talk about is the nasopalatine nerve. The landmark is next to the incisive papilla. It affects palatal tissue lingual to the maxillary anterior teeth, 1-3 to 2-3. A short needle is used. It is the only nerve that crosses the midline. So you would have your patient open. You would dry the area. And using a mirror, you would look and place topical on either side of the papilla. The next nerve we are going to talk about is the greater anterior palatine nerve. The landmark is palatal to the 7. A short needle is used. It affects palatal tissue from the 4 to the 8. In finding, you would take your finger palatal to the 7 and you are feeling for sponginess underneath your fingertip in the area. You would find, dry, and apply. Now we're going to talk about infiltrations of the maxillary. Infiltrations are done directly above each tooth on the maxillary that you will be working on. So for example, if you were working on the 2-1, the 2-2, or the 2-3, it would be an infiltration associated with the ASA. You would retract, dry, and apply. above each of the tooth. Now, if you were working above the 4 and the 5, you would place topical above the 4 and the 5, and those would be infiltrations associated with the MSA. And if you were working on 6, it would be an infiltration associated with the MSA and the PSA, and topical would be placed above the 6. The last one we're going to talk about is an infiltration associated with the PSA, which would be above the 7 or above the 8.